Medicare can seem like a foreign language at first glance. Most people have never had to think about Medicare until it becomes available to them. You might be thinking, where do I even start? Before we dive in, I would like to introduce myself. My name is Lindsay, and I have worked in health insurance and related fields with ALSUP for over 10 years. I like to think I have seen it all when it comes to Medicare plans and all the different scenarios. But the truth is, things can change, and Medicare is not one size fits all. At ALSUP, we pride ourselves in looking for the solution that is right for each individual. The right plan for you may not be the right plan for your spouse, sister, brother, parent, or friend. After reviewing how Medicare works, our hope is that it helps you to understand the basics of Medicare. That way, you can begin thinking about what this coverage will look like for you. There is so much information out there about Medicare, but today we'll focus on the basics. What are the A, B, C, Ds of Medicare? We'll talk about enrollment periods so you don't miss out on something important. We'll cover the basics of Medigap, also referred to as supplemental coverage. We'll talk about prescription drug plans and why you may need to enroll in one. We'll talk about Medicare Advantage plans and how they work. And we'll also review other important things to consider. So stay with me and let's get going. One of the most important things we need to discuss right from the start is Medicare entitlement and when you should enroll into coverage. People can be eligible for Medicare for different reasons. The initial enrollment period is a 7-month period when someone is first eligible for Medicare. If you're eligible due to age, then this period begins 3 months before you turn 65. It includes the month you turn 65, and it ends 3 months after you turn 65. For those eligible due to disability, this period begins 3 months before their 25th month of disability payments, includes the 25th month, and ends 3 months after. If you're ever unsure, you can contact Social Security directly, and they should be able to tell you your entitlement date. A special enrollment period is an opportunity to enroll in Medicare outside the initial enrollment period for those who didn't enroll in Medicare when first eligible because they or their spouse are still working and have employer-sponsored group health plan coverage based on that employment. Coverage usually starts a month after they enroll. People who are eligible for Medicare based on disability may be eligible for a special enrollment period based on their or their spouse's current employment if the employer has 100 or more employees. The general enrollment period is available if you did not enroll into Medicare coverage when you were first eligible during the initial enrollment period and did not qualify for the special enrollment period. You will still have the opportunity to enroll during the general enrollment period, which runs from January 1st through March 31st each year, with coverage beginning the month after you sign up. There are some reasons why you would choose to defer Medicare enrollment. If you're employed with an employee health plan coverage, you can enroll in Medicare Part A, which is inpatient hospital coverage, at no cost during this time, but you're not required to. If you are enrolled in an actively employed spouse's plan, you also have the option to delay Medicare enrollment. The decision will likely come down to how good the employer coverage is, how expensive it is, and if it's working well for you or not. If you are contributing to an HSA, then you will need to be sure to stop contributing 6 months prior to taking Medicare, as you can receive a tax penalty on any money you contribute to an HSA once you enroll into Medicare. Even though you can no longer contribute, you can still use existing money in an HSA to pay for Medicare expenses, like premiums, copayments, and deductibles. So, when should you enroll in Medicare? It's very important that you are aware of your Medicare enrollment periods because making the wrong choice on when to enroll, or no choice at all, can be expensive and can compromise your health care. If you know you're going to stop working by a certain date and have held off enrolling into Medicare, that is absolutely fine. But there are steps you will need to follow in order to get enrolled into Medicare coverage at the later date. You will need to have your current employer, who you hold your health insurance through, complete an L564 form. This will open up the special enrollment period to pick up Medicare and also proves that you have had coverage that paid primary to Medicare. You have 8 months from the date that you stop working to get enrolled into Medicare Parts A and B without penalty. but you only have 60 days to get enrolled into your Medicare Part D drug coverage without penalty, so it's very important to plan ahead. You would also use this form if you're a dependent and your spouse stops working. If you have pre-existing conditions, you should plan ahead to make sure you get enrolled in the right coverage for you from the start so you don't miss out on your guaranteed issue right. You should never have to answer medical underwriting questions to get enrolled into a Medicare Advantage plan or prescription drug plan, but you may not always have a guaranteed issue right to get into a Medigap supplement policy. Everyone who is Medicare eligible based on age has a guaranteed issue right during their first enrollment to a Medicare plan. At that time, you cannot be turned down for any Medicare plan selection. You may need to pass through medical underwriting if changing plans in the future. There are only 3 states right now who offer a continuous guaranteed issue right for those supplemental policies. Those states are New York, Connecticut, and Massachusetts. For all other states, you have 6 months from the date that you pick up Medicare Part B, where Medigap supplemental policies cannot ask you medical underwriting questions. They can't deny you based off of pre-existing conditions or hike up the rates because of pre-existing conditions. Beyond that 6 months, they can ask you medical underwriting questions. Oftentimes, people wonder why they should even consider Medicare while they're still working. There are reasons why someone who is currently working and has employer coverage would choose to opt off of the employer-based insurance and move fully to Medicare. Things like stable premiums, lower deductibles, lower out-of-pocket cost, and broad networks make Medicare an appealing option. People can choose to get Medicare healthcare coverage in several ways. This chart illustrates the 2 paths of Medicare. You have the option to keep original Medicare and add on a standalone drug plan and a Medigap supplemental policy. Or you could enroll in a Medicare Advantage plan. This is also known as Medicare Part C. Which path you choose really depends on how you want the coverage to work for you. Let's talk about the first path with original Medicare. It's possible to have original Medicare Part A and Part B, along with a Medigap supplement policy and a standalone drug plan. Choosing to take original Medicare with a Medigap supplement and drug plan comes with its perks. One of the main reasons people choose this path is because of the flexibility when it comes to the providers. With Medicare and Medigap, you can see any provider in the United States who accepts Medicare. Unlike an HMO or a PPO, where you have provider networks, the only question you need to ask when searching for new providers or verifying with existing providers is, do you take Medicare? If the answer is yes, you can see that provider with your Medicare and your Medigap supplemental policy, even if you're traveling outside of the state that you reside in. Medigap follows in line with original Medicare, and because Medicare does not offer drug coverage, neither does a Medigap supplemental policy. This is why you would need to choose a standalone drug plan to go along with your Medigap coverage. As of 2020, no Medigap policies cover the Part B deductible for outpatient medical services, but this deductible is still quite low. There are very comprehensive policies that cover the Medicare Part A inpatient deductible. Medicare coverage alone is 80-20 coverage, meaning Medicare is going to cover 80% of the costs of Medicare-approved services. But if you only had Medicare, you would be responsible for that remaining 20%. That doesn't sound so bad. However, there is no max out-of-pocket limit or safety net on Medicare coverage. So if something catastrophic happened, that 20% is going to add up very quickly. The most comprehensive Medigap policy will pick up the remaining 20% after you pay the Part B deductible. The current cost of the Part B deductible is shown on your screen. Medigap supplemental policies cover the gaps in the original Medicare program. Medigap covers 20% of the remaining medical services after Medicare is billed for the first 80%. The Medigap supplement policies typically cover deductibles for Part A. They pay for additional hospital stays beyond original Medicare, and they may even cover excess charges. Medigap plans have an additional premium on top of Medicare's premium, and depending on which policy letter or carrier you go with, these premiums can vary significantly. This chart illustrates the different types of Medigap policies and what they cover. Something important to know is that many different insurance carriers can offer Medigap policies, and the policy benefits are standardized. So the same plan is going to offer the exact same coverage, no matter which carrier you enroll with. But because they are private companies, they can charge different rates for that exact same coverage. Historically, we have seen different Medigap policies come and go. On April 16, 2015, H.R. 2 became public law. H.R. 2 includes a provision that prohibits Medigap policies from covering the Part B deductible for people who become eligible for Medicare on or after January 1st, 2020. What this means is that Medigap policies F and C are no longer offered. Individuals may keep Medigap F or C if already enrolled because of the grandfather clause. Medigap policy G is now the most comprehensive coverage option available. To recap, there are several reasons why people may choose a Medigap supplement policy to go along with their original Medicare. A Medigap policy may be a great option if you want to see out-of-state providers. Medigap is portable, so it's going to travel with you. Again, as long as a doctor accepts original Medicare, they should take that Medigap supplement policy. If you have a major surgery or procedure expected, if you have frequent medical needs and procedures, or if you really just want that peace of mind that you have that more comprehensive coverage. Choosing the correct drug plan is crucial, and only 5% of seniors choose the least expensive drug plan. This is something that you may change on an annual basis or let roll over year after year depending on the plan and if your medications change. On average, overspending is $368 a year on prescription medications. The more options available, the more likely an individual is to overspend. And on average, a zip code has 23 different plans to choose from. As we talked about in the beginning, there are two different paths when it comes to Medicare plan options. We just reviewed the first path with original Medicare, a Medigap supplement policy, and a drug plan. So let's jump into the second path, Medicare Advantage, or Part C of Medicare. Medicare Advantage plans are bundled plans, and you'll use the one card from the Medicare Advantage plan carrier, unlike the original Medicare path with a Medigap policy and drug plan, where you have 3 different cards to take to the doctor's office, hospital, and pharmacy. You still have to have original Medicare in order to access the Medicare Advantage plans. But instead of them acting as a secondary payer, it's almost as if you're trading in your original Medicare 80/20 coverage for better benefits. Unlike Medigap policies, Medicare Advantage plans contract with providers, and it's important to be sure your doctors are considered in-network with the plans to avoid higher out-of-pocket costs. Let's talk about how Medicare Advantage plans work. These bundled plans cover all Medicare-covered services with a single premium versus multiple premiums with original Medicare, a Medigap policy, and a standalone drug plan. You must continue to pay the Medicare Part B premium in order to access the Advantage plans, and you may or may not have an additional cost added to that premium with the Advantage plan. Medicare Advantage plans are network-based HMO and PPO plans. With an HMO, you must see providers who contract with that particular plan, and they generally won't cover out-of-network services except in an emergency. With a PPO plan, you do still have a provider network, but you have the option to see providers who are not necessarily contracted with the plan, as long as the provider is willing to bill the plan. You typically pay less if you use providers that belong to the plan's network. With the Medicare Advantage plans, the prescription drug coverage is usually included, but you do still have copays and coinsurance when filling prescriptions. A Medicare Advantage plan sometimes includes extra benefits like vision, dental, and fitness programs. So why might you choose a Medicare Advantage plan? A Medicare Advantage plan may be a great option if you want the convenience of getting your coverage from one source. With Advantage plans, everything will run through one card, so you're not juggling different cards for different things. Maybe you want lower premiums than you would pay for original Medicare, Medigap, and Part D combined. The money that you're saving monthly, you could put towards copays and coinsurance in the event that you have to use medical services. You may want additional benefits that aren't covered by original Medicare, like dental, vision, and fitness. A lot of times, these additional benefits are included at no additional cost, but the plans do sometimes also offer optional supplemental packages with more comprehensive benefits for an additional premium. The cost of Medicare can fluctuate on an annual basis, but the current premiums, deductibles, and copays and coinsurance are shown here. The Medicare Income-Related Monthly Adjustment Amount, or IRMA, is an amount that you may pay in addition to your Part B or Part D premium if your income is above a certain level. The standard Part B premium is shown on your screen, and this is subject to change on an annual basis. If your modified adjusted gross income, as reported on your IRS tax return from 2 years ago, is above a certain amount, then you'll pay the standard premium amount and the income-related adjustment. This chart shows the different income brackets and premium amounts. If your income will change significantly from what it was 2 years prior to when you go to sign up for Medicare because of a life-changing event like retirement, you can request that Social Security complete a Part B redetermination. If you do nothing, then eventually the premium will go down according to your income, but it is usually worth it to look into this. Allsup's solution is an unbiased survey of healthcare options available to each person. We offer consultation to review your specific situation and the plans available to you in your area. All the benefit specialists here at Allsup have active health and life insurance producers license, but what sets us apart from an insurance agent is that we are not contracted with any particular carrier. This allows us to use our years of health insurance experience to help you navigate Medicare and find the plan that is right for you. If you qualify for Medicare and are considering your Medicare options for the first time, or if you're reevaluating your current coverage, it's important to make sure you are getting the healthcare and prescription drug coverage that is right for your specific situation. Also provides you with the very important value of a trusted, experienced professional to help you navigate through the dozens of Medicare plans available. We hope this presentation has helped to make sense of the basics of Medicare.